is by systematic sampling. So there are about 8 HIV specialized clinics in Manicaland province, and we're going to pick 1 in every 3 clinics. So which means we're going to pilot our project in 2 clinics in Manicaland province and run it for approximately, run it for 5 years as a pilot, and then evaluate it afterwards to see how it would have impacted and if we can scale it up. And we'll also be very ethical as we're doing our things. As you shall see later on, we're going to engage all the important stakeholders, all the custodians, and make sure we are above board. And also uphold confidentiality as we are interacting with the youth in Manicaland province. So our implementation is mainly based on what is called the Lewin's change model. This is a model that is used when you're implementing change, mostly in organizations, but we're also going to use it for this particular project. So you unfreeze first, that is, you're doing away with the already existing ideologies and beliefs that people have. In this case, we are convincing community leaders, adolescents with HIV, people in the clinics, that there is need to integrate mental health services into their already existing HIV programs. Then we implement the change by rolling out our program, training them on our service model, and making sure that it starts being implemented. And then we freeze that change. That is making sure they've grasped what we have given them, and then they keep implementing the model even after the program ends. So first of all, remember we said we want to be above board. So we are going to engage all the important stakeholders from the Ministry of Health and Childcare, who are the custodians of health in Zimbabwe. We also engage the community leaders, because those are important thought leaders in the community. They're going to help us shape a culturally contextual model, and also help the people adopt the model better. We're also going to engage with the adolescents living with HIV, people with lived experiences of mental health disorders, as we are formulating our model. And then we're also going to do a situational analysis, see the people's needs, and see where we can fit in our model into their particular needs. And then we are going to develop our service model, again together with the stakeholders mentioned earlier, but especially focusing on the adolescents with HIV, the people with lived experiences, and also the caregivers to these adolescents living with HIV. Then we come up with a robust model that will then roll out. So rolling this out will mean training the healthcare workers. So we're going to include all the nurses at the designated 2 clinics. The nurses that cater to adolescents at those clinics will all be trained on our model and how to implement it and how to roll it out to the adolescents accordingly. Then we also engage the community, because in as much as we have trained the nurses, the community also needs to know and understand what we're doing, and these adolescents are also in the community, their caregivers are also in the community. So we then do awareness raising campaigns, advocacy campaigns, posters, social media, basically any channel that we can use to disseminate information to the community, engage them, make sure they are also on board, and they also understand what we're doing and why it needs to be done. And then the last part of that will be sustainability planning. Sustainability planning. Remember, we said we are rolling out our program for about 5 years. So after that, then what? So we need a plan such that even if we don't continue with our project, there's a plan in place for it to continue even after us. So how we are going to do that is to also work hand in hand with the ministry. Remember, we said they're the custodians of the health sector in Zimbabwe. So we work hand in hand with them such that even if we don't manage to get funding to continue, they can continue running with the project and probably even scale it up. And then we will also have partnerships with other non-governmental organizations or even other organizations that are of interest in the particular areas that we'll be dealing with. Thank you.
Hi, everyone.